Hey, this is Colleen from Let's Talk About It, day 2 after my occipital nerve decompression surgery. A couple things. One is, again, I don't really want to show you my drain, but I have a tube that goes from the back of my head that drains the blood and fluid out of my head. I would say it was roughly half, yesterday it was roughly half of what it was the day before, and it's slowed down quite a bit. So that's really good news. I do have to dump it every day, which is kind of gross. Dump it and measure it. I see the doctor Monday, so if I have less than 20 cc's coming out every day, then I can have the drain removed. If not, it's going to stay in for a little bit longer. So you can see I'm taped up a little bit here because it's actually coming out of my head over here. Today, I definitely feel like the anesthesia was wearing off. I felt much more pain today, extremely tired. So I really slept most of the day today, to be honest, which was good. Still having trouble with dizziness. Again, I have vestibular migraines, so don't base what you think you might be going through when you have the surgery on me, because I have vestibular migraines. It's improving. I still need somebody to walk with me or help me to stand. I can't walk on my own and I can't look up. So I'm hoping, again, every day that gets a little bit better. The swelling in my face has gone down quite a bit, and I had some swelling in my hands that has gone down. That was from my IV. My head feels very weird. It's numb in the back. Can't really feel it touching anything on the sides. It's a weird, when your Novocaine starts to wear off when you're at the dentist, that's what my head feels like all around here. And I do have some head pain. I get some head zaps here and there, but I am taking Percocets and they help. I will say that what we learned today is that I should not let the time lapse on my pain medication, because I did early this morning. I slept through when I was taking my medication rather than being awakened, and that was bad. It was hard to kind of get control of my pain again. So, but the pain is very manageable. Again, I'm taking medication, but the pain's manageable. The dizziness is a problem. I'm still very nauseous, but I'm taking Zofran. My appetite is not great, crackers, bananas, toast. I just did have a little pasta, the meatball. I don't know how that'll sit. We'll see. So I am eating. I'm trying to stay hydrated, drinking, a lot of water. My throat is very sore, so I am also hitting the Sprite. The cold bubbles seem to be helping. Again, I had a tube in my throat for 6 hours, so it's going to hurt. So I guess this is like, as things wear off, I'm in a little more pain and also very, very tired, but it's doable. So again, I'm very, very lucky that I have a lot of help. My sister's here now. My brother took me for the surgery and I stayed at his house the first night. And my niece is here. So we're going to watch Hunger Games Part 2 tonight. And that's it. So day 2 under our belt. We'll see how it goes. Just so you know that what to expect as far as the nerves go. The nerves that he worked on will actually be numb for probably about 4 to 6 or even 4 to 6 months or longer. And as they start coming on board, we'll measure what my relief level is. Because of that, I can't have any ice or any heat whatsoever on my head or on my neck, because you can actually burn yourself, because those are sensory nerves and they're not online right now. So I can't feel that kind of stuff. So I just have to be careful. I am using some CBD cream on my shoulders and my neck that it's a little painful. So that's giving me some relief. And I do have, of course, a heating pad on my lower back. Other than that, I'm doing okay, and just, can't really move my head too far to the left or right yet. Again, you can kind of see where my bandages are. They're pretty thick. Can't really feel much even when I touch it on the back of my head. It doesn't feel like much of anything. So day 2 down. See how tomorrow is. Tonight, I sleep. Thank you, everybody.